Hello everyone. So today we will be discussing that's most important as well as it's a very interesting topic, that is allergic rhinitis. So the allergic rhinitis is an immune response produced by the body that is triggered due to some allergens, that may be pollens or dust mites or maybe animal dander. So some persons have allergy to seafood as well as the milk products. And so what are the common symptoms? Symptoms of the patient is recurrent sneezing, rhinorrhea, that is watery discharge from the nose, that is ocular irritation, that is itching, sometimes headache also, decreased sense of smell also. So there are a lot of symptoms. So I have just discussed about the few symptoms. Mostly the person cannot concentrate on his day-to-day life, so it hampers some day-to-day life also. So what are the things if we ignore these allergies, what it can provoke to? It can provoke to chronic rhinosinusitis, that is sinusitis inside the different sinuses, ear infection like otitis media with effusion, and some persons may suffer from obstructive sleep apnea. And in the children who are prone for this allergic rhinitis or allergy can land up into adenoid hypertrophy in future. So mostly the allergic persons are more prone for asthma also. Okay, so we have a lot of investigation regarding this allergic rhinitis, but mostly the thing is required is the proper history of the patient. Next, coming to skin prick test. So the skin prick test will tell the particular in which particular allergens the person is having allergy, according to which the person should avoid. If the person is having the normal this allergy to dust mites or this animal dander, so he should avoid this type of allergens, so that there will be no any immunological response in the body. Okay, then coming to our treatment protocol. So for my patients, I usually, in case of there is mild, moderate, moderately severe, there are a lot of criteria. This ARIA criteria is there. So for my patient, I always tell them to first clean every day. They have to, the common thing in the home are the danders as well as the dust mites. So the patient should always clean their beddings, pillows and everything, and the clothes they are wearing should be properly hygienic condition. Next, coming to if they are traveling to some dust and windy areas which can trigger the allergy, so they should wear the mask. That is another requirement. And the next, the treatment, just like they have to in the treatment protocol, I prefer to give the patient with the oral antihistaminics. There are a lot of oral antihistaminics which is present in the market, that is mainly cetirizine, levocetirizine. You have already heard loratadine, this bilastine, new molecule, and another new molecule that is coming up now is the Avastin. Avastin is a very wonderful drug. So it's an OD dosing. So if the symptoms are not controlled by the antihistaminics, we will just go for upgradation, going towards the intranasal corticosteroids. We can also use with it. So these are the mostly topical as well as the oral medications we can try. And the next is another thing is the immunotherapy. Nowadays, a lot of persons are going for the immunotherapy also. It has also got good response. So for my patients, in the brief, I should advise first always consult an ENT doctor, because he is the person who can actually judge what is required, what is right and what is wrong for you. Next, identify the allergens which you can be sensitized and you can trigger the allergic rhinitis, and take a proper advice and adequate medication or the treatment in a proper time, so that it will not hamper your day-to-day activity. So that's all. I think this will be a helpful session for you on my small topic. Thank you very much.